Good evening. We are Mr. and Mrs. Garud. He is my husband, Ravindranath Garud. I am Mrs. Sugandha Garud. I want to tell you our story. 10 years back, it was the 2011, we were on the tour of the Punjab. After seeing the Amritsar and every hectic trip, as soon as we reached the Nagpur, at the station only, he was feeling giddiness. As we reached at home, he fell down. And we were so nervous at that time. But luckily, our neighbors are doctors. They came, they diagnosed that his wall is not working. And they recommended one doctor, private doctor. In the early morning, we went to the doctor, and he had his bypass. At the same time, they changed his wall. Everything was going well. After 10 years, last month only, again he was feeling the breathlessness and suffocation type, and feeling some laziness and dizziness. So what to do? Again we reached the same doctor, but the cost, he told us, it was beyond our limit, and it was not affordable to us. So we were thinking and thinking. 50 days has passed. After that, one of my son-in-law, he is here, Mr. Dr. Sumit Dheer. So I called him. He's so gentleman. He said, okay, auntie, don't worry. If they are saying the cost is high, you come to the Ahmedabad. You will not get the same what you feel there. So you come here. I said, where we will live then? What will happen here? He said, don't worry, I am here. You come to Ahmedabad. And he gave me the number of Dr. Manik Chopra. And he said, you just contact him and you get connected with him. So I called Mr. Manik Chopra. For the first dialogue only, I was so relaxed. He explained me each and everything. And I had faith in him. I said, okay, shall I come to the Ahmedabad, and when and how? He said, you come by air. I am here only. Then we decided the date. He was also here at the time, and we fixed the date. We came here. My son and my daughter was with us. And as soon as we reached here, we got such a nice treatment in the hospital. We are having one suite in the hospital. The lunch, the dinner, the breakfast, everything we are getting here. Second day, early in the morning, we met Mr. Dr. Manik Chopra. He came here. He has procedure, as the hospital is saying, and echo, then ECG, everything he has done. And he said, okay, no problem. We'll take 1 day rest, and tomorrow, day after tomorrow, we'll go for surgery, and don't worry. It will be easy, and it will be in your limit. I said, okay. So on 11th of the December, he got operated. It was the wall without surgery. The wall was costly, but still it was in our limit. And the surgery was so nice. Very same day, shifted to the ICU. There he was staying there for 2 days. We visited ICU so many times, my daughter, my son, and we are getting such a nice treatment there. And we were relaxed. We were in the suite, and we were enjoying the hospitality of this hospital, Narayana. All the staff, all the nurses, all the brothers and sisters, and all the working staff. It was wonderful. They are very caring, very loving. So our stay was very good. Yesterday only, he shifted to the room. And he is okay. 2 to 3 times, Dr. Manik Chopra come to the room. He examined. My son-in-law here used to come here 2 to 3 thrice in a day. And all his parameters are normal. Now he is walking himself. He is not asking for the help. He is going to the toilet. He is going everywhere. And he is eating nicely. Now in the night also he sleeps very nicely. Peaceful sleep he is having. And we have full faith in this hospital. And we are very happy and we are very lucky to get this hospital and these doctors. I hope that I will tell everybody to come here. This hospital is really nice. Whatever I'm saying, it is less, but I want to tell so many things about the hospital. All the staff is very good. God bless them. I will pray God that will bless them.
Good evening, this is Dr. Manik Chopra. I am a interventional cardiologist practicing at Narayana Multi-Specialty Hospital, Ahmedabad. I subspecialize in structural heart disease interventions, mainly transcatheter aortic valve replacement, transcatheter mitral valve replacements, and other valvular interventions. This is about Mr. Rabindranath Garud. He belongs to Nagpur and he had undergone a mitral valve replacement surgery with a bioprosthetic valve that is made up of tissue with coronary artery bypass surgery in 2011 at Nagpur, and he was doing very well, but since last 1 or 2 months he was having breathing difficulty on walking, and he also went for a echocardiography at Nagpur which showed that the mitral valve which was replaced earlier has degenerated and has narrowed, and there was a lot of leakage also in that valve. He underwent a coronary angiogram and a CT scan at Nagpur, and was advised transcatheter mitral valve replacement because conventional surgery was considered to be very high risk. When I say surgery, I mean since the patient had undergone a previous surgery 10 years back, the second surgery would need opening the chest for the second time, and in general at age more than 70 years with a probably slightly frail person, it would be considered to be a very high risk surgery. So that's why the option of transcatheter mitral valve replacement was given to the patient. In transcatheter mitral valve replacement, there is no need to open the chest. There is no need to put the patient on heart-lung machine. There is no need to give general anesthesia for a very, we do give general anesthesia, but that is for a short period of time, like an hour or so for the procedure. And it requires a short ICU stay of 1 day or so, and recovery within next 3 days or so. And mostly the patient is discharged by day 3, day 4. We do it from the groin. We take a large vein of the body, which is called as femoral vein, and we introduce our sheath, which is a tube-like structure, into the great vein of the body, and from there we go to the right side of the heart. We cross the septum, which is a wall in between the right and left side of the heart, and we enter the left atrium. And once we enter the left atrium, from there we pass on a wire across the mitral valve, and then we take a transcatheter mitral valve over this wire and replace it by putting the new transcatheter heart valve inside the previously implanted surgical mitral valve. And when the patient came to us, we admitted and we did a transesophageal echo to be sure that there is nothing else, there is no paravalvular leakage, and we did blood tests to be sure that there is no infection and his kidney functions are good. Did a CT scan assessment to be sure that the procedure is doable. The next day we did the procedure. It took almost 1 to 1.5 hours to finish the procedure, and the patient was shifted in ICU. After the procedure, by evening he was mobilized in the bed. That means leg movements were allowed. Next day morning he was fully mobilized out of the bed, and by afternoon or evening he was shifted to the room. He stayed in the hospital for next 2 or 3 days and then was discharged, and before discharge also he was able to walk and do all his routine activities nicely. We wish him very good health, and I thank Narayana Health and all the members of Narayana family for support and doing their best for treatment of patients. Thanks.